But we begin with the Prime Minister, Jacinda Ardern, as New Zealand records a new daily record for cases of COVID-19. Now, for the sake of transparency, her office granted Q&A a total of 2 interviews this year with time limits. This, our second interview, was scheduled on a week and at a time of her office's choosing. It was filmed on Friday morning, and because of COVID restrictions, it couldn't be in person. I began by asking Jacinda Ardern about the pandemic response. I think about those words you shared at Waitangi when you spoke there as Prime Minister for the first time. Hold us to account, you said, because one day I want to tell my child I earned the right to stand here. History will record that in the face of a deadly pandemic, you began relaxing public health restrictions from those toughest restrictions with a Māori vaccination rate 26 percentage points behind that of the general population. You can't reject those numbers. You cannot reject those numbers.
I've answered the question. Yeah, I absolutely reject that. You are suggesting that moving to level 3, which is, as I have already stated, some of the toughest restrictions for anyone to endure, indeed for a prolonged period. I don't need to tell you how long you have been in restrictions in Auckland, and we have done that because we have pursued some of the highest vaccination rates relative to other countries that we've seen in the developed world. We have overtaken the United States, Israel. We're now chasing hot on the heels of most of those European countries, and still we have restrictions. Now, I've had strong calls to ease, if I may. I've had strong calls to ease more quickly and more rapidly, but we have moved very cautiously for the precise reason that you've raised, to do everything we can to protect people, and we continue to do so. But at the same time, we have now, unfortunately, a virus that is not behaving as it did before. We must use vaccines. And we've seen now rates in Auckland that are astonishing. But we continue to pursue the safest option possible to protect people while beginning to move forward.
Okay, I mean, you can reject, Prime Minister, you can reject whatever sentiment you think I have. You cannot reject the numbers. The day you made that decision, Māori were 13% of all Delta infections. Today, they are 36%. Dr. Rawiri Taonui, who is mapping Māori infections, says this is now shaping up as the biggest social, economic health issue to affect Māori since the Second World War, and that's on your watch.
But you are asking me these questions from a city that continues, after 70 days, that continues to be in restrictions. I think what you're suggesting is that we should have had 70 days of level 4. At the time that we moved to level 3 and we started easing, and when I say easing, allowing people to see loved ones outside, Dr. Jansen described it as a compassionate decision. There are many competing things that we have to constantly weigh up. I have to constantly weigh up, yes, people's health and protecting people, and that's been the top of our decision making. But I also have to weigh up the impact on people's mental health and well-being, people's economic status and their livelihoods, issues of family safety. All of these issues are at play, and you will hear people in many different corners voicing these concerns. But our response has been a consistent one, Jack. It's been utterly consistent. People first. And that is why New Zealand sits amongst very few countries that can claim to have the death rate that we've had, 28 too many. But when you compare it to the rest of the world, we have not seen the devastating impact of others because of the choices we've made.
Let's talk about the rest of the world. In August, less than 2 weeks before Delta was confirmed in our community, you ruled out using domestic vaccine certificates despite the fact they were being used all over the place to handle Delta overseas. Why did you do that?
Yeah, I don't actually consider myself to be nearly as black and white as I've...
Sorry to interrupt you, but we're just short on time. To clarify that point, why aren't vaccine certificates ready? Why did you take until the second half of this year, when Delta was in 163 countries and vaccine certificates were being used in dozens of countries overseas, to finally start developing vaccine certificates in New Zealand?
So we have a vaccine pass system that's already available. We're trialling it digitally next week. Of course, you do have to make sure that you have an environment where people have had the chance to be fully vaccinated before you use them. We could operate on a paper-based pass now. In fact, I know individuals who have carried the COVID pass that we already have in the United States, where that is as sophisticated as their system is. We work to develop something more sophisticated so that businesses can use a scanner to ensure that it is a verified vaccine certificate. So we've developed something a little more sophisticated than what some other countries have, but we could use a paper-based system now if we so chose.
When will the digital version be 100% operational?
Before we move into using them routinely as part of the COVID protection framework,
so
which of course
this month or next month
could be if we see those vaccine rates continue, could well be this month. We are, as I say, from next week trialling in different settings the use of those vaccine certificates so that they're all ready to go.
After the break, we try to get clarity on the future of Auckland's border.
We will have Aucklanders able to travel through summer, and they will be able to reunite with family for Christmas.
We have been canvassing sentiment among Auckland businesses this week. And we should say, many businesses have told us the wage subsidy and resurgence payment have been really helpful. But clearly, some are fed up. We spoke to one hairdresser who said customers are putting pressure on them to do illegal haircuts in parks. And here are a couple of quotes from businesses we spoke to. We can't tell what the hell is happening from a government perspective. All the Prime Minister does is announce reassessments, which makes it sound like the government has no plan. What will you do to repair your relationship with Auckland's business community?
Well, of course, what we needed to do is provide, in the uncertain environment of COVID, as much certainty as possible. The COVID protection framework sets out that unlike the past, where you did have situations where businesses may be periodically closed, sets out a future where actually businesses continue to operate regardless of the status of the pandemic. And that's because we're able to use other public health measures to keep people safe. So that gives them that certainty. So for Auckland businesses, they know once we hit that 90% target, we move into that new framework, and those businesses, whether you're a hairdresser or hospitality, are able to open.
What does it say about the coherence of your government strategy that a month before the summer holidays, your COVID-19 minister and your finance minister are publicly contradicting each other when it comes to plans for people leaving Auckland over summer?
On the border, you know, the thing that we've been absolutely clear around is that we will have Aucklanders able to travel through summer, and they will be able to reunite with family for Christmas. So the challenge that we are very openly sharing that we are working our way through is, of course, in the new COVID protection framework, once we have a highly vaccinated Aotearoa, we will not be using hard borders. But it is something that we have now while we are in what is admittedly a tricky transition period. It is helping us contain the outbreak while we vaccinate and keep people safe.
Will we have to book a time to leave the city?
That presents a logistical challenge, and we've been open about that, of how do we use the tools available to us to prevent the outbreak spreading outside of Auckland's border whilst allowing people to move. So, Jack, that means finding a way where 30 to 40,000 people can safely move through the border in a way that is not logistically challenging, both for those travelling and for those operating. So that's what we're facing. We're working it through, but we are committed to people being reunited over that summer period.
I'm sorry, so you haven't answered that. You've just been talking about the importance of providing as much certainty as possible to businesses and people who are still in lockdown.
So what people are looking for is logistically how we will undertake those checks at a land boundary that New Zealand traditionally has never had before. And what I'm sharing is that is what our officials are currently working through on ways that we can make that as seamless as you possibly can, given we do not traditionally operate land boundaries.
Would you support Aucklanders having to book a spot?
When we have the information to provide around the date and the way it will operate, we will do so. But as you can imagine, it is not an easy easy exercise and one I want to make sure that before I put the information out, I can answer all of the questions you'll have.
There are hundreds of COVID positive people currently isolating at home in New Zealand. Why won't you allow COVID negative Kiwis who are double jabbed to return from comparable countries and isolate at home as well?
Yeah, because as you'll have seen from those that we've always listened to and heard evidence from in our management of COVID, and as you've seen from other countries, the border is the last lever. Okay,
so please, you've laid out the framework. All I'm asking is what is the scientific reasoning that somehow it is okay to have COVID positive people isolating at home at the moment, but COVID negative people who've been tested and double jabbed can't do the same thing?
So, if I may, the scientific reasoning, of course, is, as we all know, a simple test on entry doesn't tell you whether or not someone is COVID positive. And a vaccine doesn't stop you from necessarily being COVID positive. It reduces it, but not completely. All of the modelling that has been done for us as we've transitioned into working on our new system, is that without any controls at the border, you will seed further outbreaks that will lead to greater hospitalisations and greater deaths. So you do need to have border controls still, unless you want to be overrun. Yeah. So the border controls, of course, that we're operating on the basis of still allow for us to continue to test people while they're isolating, for the very fact that that first test doesn't tell you if they have COVID, but a day 5 one, for instance, does help reduce the risk, which is exactly what we do with our contacts in New Zealand, and it's how we're treating cases at the border. When we have New Zealanders returning home, we will have tens of thousands at a time. So the reason we haven't flipped straight to home isolation is we do want to make sure that we've got those safety mechanisms in place to make sure people can do it safely at home, they can be tested at home, and we just reduce down the risk. Even then, it won't be perfect, Jack. You know, we are factoring in that we will continue to likely have cases that may be seeded from the border, but you want to reduce down the scale of that, because once you open it up, it's not something that you can easily put the lid back on, and nor do we want to.
I want to ask you a couple of questions before we leave you about non-COVID related things. In 2017, you were elected on a promise to tackle the housing crisis. In your time in office, median house prices in New Zealand have increased 47%. Now, you say you don't want house prices to fall, but you do want them to be affordable. So, indexed to the median household income, what is an affordable house in New Zealand?
I've said that I don't want the housing market to collapse, but of course what's happening at the moment is completely unsustainable. And of course what will be affordable is always relative to someone's income. What I use as a guide is what's happening with our first home buyers. I saw in the last September quarter, my recollection, Jack, is that they've made up roughly 25% of transactions. I want to see that number grow, and I want to see the number of New Zealanders who are in their own home grow. And increasingly the trend that when we were elected was that was declining. So yes, we have seen house price growth. We've seen house price growth in some areas that is just unsustainable and making housing unattainable. And so that is why we've done everything from changing the tax system to changing even the way that we're seeing consents fast-tracked, changing some of the planning rules so that you can see greater intensification. And that's the suggestion is that'll bring an extra 100,000 homes. We've seen record consents. We've seen predictions that some of these changes will start to see a cooling. But I won't stop pulling every lever we have to make a difference to those who are seeking home ownership.
So please just answer my question then, because you just said that affordability is relative to someone's income, which is exactly what I'm asking. So relative to the median household income,
I'm not going to put a number. I'm not going to put a number on that for you because Jack, it will, something that someone in Auckland may consider affordable will not feel affordable necessarily to someone in another part of the country.
Prime Minister, this is how an index works. It's a basic economic principle. That's it. Median household income to median house price. It's a very basic and widely used international standard as a measure of housing affordability. And you aren't prepared to tell us what you think an affordable house is.
And of course, housing affordability and whether or not people are in housing stress, of course, is used as a measure against someone's income. And of course, we've seen in New Zealand that consistently people are paying over 30% of their incomes on their housing costs. Consistently, many on restricted incomes, such as government government support are paying vastly more than that. So, of course, it is a relative measure, Jack. We do want to keep improving and reducing those costs because we know we have been in the midst for some time now a growing housing crisis that as a government we have committed ourselves to and continue to be committed to.
Still haven't answered the question, Prime Minister. Hey, before we let you go, it is the Labour Party
Jack,
conference this week.
I'll continue.